Hello, I'm Karen. Today we're going to be doing a head to toe on baby Voldemort here. So we're going to unswaddle him. He was born 12 hours ago. The first step we're going to do is check his skin color, make sure he's all pink, make sure nothing's wrong with him, and then we're going to do vital signs. So we're going to check his temperature under his armpit, which should be between 97.5 and 99.3. His is 98.3, so that's good. We're going to also look at his chest rising and falling. We're going to check his respirations. They should be between 30 to 60, and his is 58, which is good. His heart rate should be 110 to 160, and his is 157, so he's good. If he was crying, it'd be a little bit higher, around 180, and if he needed some interventions, it'd probably be below 100. 100 is usually like where it's at when they're sleeping. Blood pressure is usually between 60 and 80. Systolic and dystolic would be 30 to 45, and we would check that on his thigh. For circumference, we would check his chest and his head, and for his head, we would do above his eyebrows, above his eyes. But everything looks healthy. We would also check the length of him. We would take 1 point from his head all the way down to the heel of his foot. So I would take his leg, extend it all the way, mark it, and that's how, his length. We would also check his APGAR, which is his activity, pulse, grimace, appearance, respirations. So APGAR should be anywhere between 0 and 10. If it's below 6, we would need to take interventions. The better his appearance is. So if he's pink, it'd be 2. If he was blue, he was 1. If his respirations are low, he would be either 1 or 0. So we would score everything by 2. His skin, we're gonna check out his skin, make sure he's obviously pink. Make sure there's no, he's not like all the way blue. His feet and his hands, that's okay to be pink. That's known as acronosis, and that's normal in newborns and infants. As we're doing that, we'd also check for webbed fingers, webbed toes, extra fingers, extra toes. And we're also going to look for moles, birthmarks. Some babies have stork bites, which is blood vessels underneath the skin. They're normally on the forehead, and it's going to be kind of like a triangle, diamond shape. On the forehead and also in the back of the neck is the most common spots. Strawberry hematoma. It's a type of birthmark that is caused by extra blood vessels. This is normal in premature infants. Port wine are tiny blood vessels enlarging, causing a birthmark. Mongolian spots, it's flat bluish skin marks caused by melanin underneath the skin. The Harlequin sign is when the back of the baby will have a straight line. One will be a normal color and one will be kind of like pale, and it's a very distinct line. All of these are normal, especially the Harlequin. This one will resolve itself, but all the other birthmarks and everything are normal. So there's nothing really to worry about. Vernix, we're also going to check for that. That is the leftover from the fluid in the sac. So it's going to be under, folds, creases, in between the butt cheeks maybe, in between the arms, underneath the armpit, in the neck folds. And it's also normal for newborns and infants to have pimple-like whiteheads over their face. This is known as milia. As we're doing this, we're gonna also take a look at his neurological. We're gonna check his gag reflex, the Babinski, suck reflex, Moore reflex. So we're gonna have gloves on, stick our finger in their mouth, making sure that they are sucking correctly, that they have a gag reflex. And then we're going to take their feet. You just stroke their foot, and their toes will fan out like that. Moore reflex, it's kind of really just like when you touch them too quick and they'll jump and startle. Tonic neck, so we're going to lay the baby down just like he is, and we're just going to make sure that there's no stiffness or anything in his neck. For babies' heads, they are born with 2 fontanelles, one anterior, one posterior. The anterior is going to be right here, and it's a diamond shape. This one closes about 18 months of age, and then we also are going to have a posterior fontanelle. This one usually closes around 2 months of age. The purpose of these fontanelles are for if the brain swells up. So the bulging fontanelles is intraocular pressure, and which is a concern. Sunken fontanelles are due to dehydration, so it's kind of just like a good like test, really, to see if the baby's okay. Caput sedaneum is swelling of the scalp that crosses the midline, which would be right here. This is caused by prolonged vaginal birth, so just the pressure of the head really on that pelvic bone from the mother. Cephalometomia is a buildup of blood underneath the scalp and does not cross the midline. That is also caused by vaginal birth, so they can be just straight down the head. Molding is normal for babies after birth. They're being pushed through the birth canal, so cone-shaped heads, whatever kind of heads, are normal, and they will resolve over time. If not, a baby usually is prescribed a helmet to wear. So for the eyes, I would take my pen light. So this is my pen light. Check the pupils of the eyes, check the shape, check the whiteness, the sclera of the eyes. Make sure there's no redness, no blood vessels that have popped, no infections or anything, because conjunctivitis is normal for a vaginal birth because they are going through that vaginal canal. With the ears, we're going to check the inside of their ears, the outside of their ears, make sure there's no abnormalities with the ears. With the nose, I would also take my pen light and I would shine it, make sure that the mucus is normal, cover one side, cover the other side, make sure there's a patency on both nostrils. Also with the mouth, I would make sure that the tongue is okay. We're gonna check out the roof of the mouth. We're gonna see how it looks, how it feels. We're just gonna pretty much look for any abnormalities in the child's mouth. We can see Epstein pearls. They are pretty much the same thing that are on the outside of the baby's head. It's just like white little pearls inside their mouth. For the neck, we're gonna palpate the clavicles, and we're gonna also, again, turn the head both sides, make sure that the neck has good range of motion. We're also gonna look for chest abnormalities, make sure that it's rising and falling okay. Make sure the baby's breathing okay. We're gonna listen. At this point, I would also listen to the baby's lungs, both sides, as well as the heart. Yes. So the respiration distress symptoms is seesawing of stomach and chest, and also it would be accompanied by baby's nasal flaring. So we want to make sure that when he's breathing that he's not making any noises, it doesn't seem like he's in pain or having a hard time to just breathe. But I would also listen to the heart in 4 different locations. So the 3 shunts in intrauterine life are ductus arteriosus, which protects the lungs from circulatory overload and allows the right ventricle to strengthen. Ductus venius, which connects the umbilical to the IVC, and foramen ovule, which shunts oxygenated blood to the right atrium. Sorry, I butchered some of those. We're going to identify correct S1 and S2 sounds, make sure that they're normal. And then we're also going to check capillary flow, because if you check baby's toes and fingers and chest, if it's bright pink, it means they have good circulatory movement. Abdomen, we're going to make sure that the abdomen is normal shape, it's not distended. We're going to listen to the bowel sounds, just gently push on the stomach. Check out the umbilical cord, make sure there's no foul odor, no pus coming from it. It's normal to have some crust, but the umbilical cord should fall off between 10 days to 14 days. The umbilical cord has 2 arteries and 1 vein, and it also contains Wharton's jelly for structure. We're gonna also check out their genitals for a boy. If they were circumcised, we are going to make sure that there's no, again, foul odor, pus. We're gonna make sure that it's crusting over okay. Whenever we put a diaper on a newborn baby who was circumcised, we're gonna put petroleum jelly so that the tip of the penis does not stick to the diaper. And as well for baby girls, we're gonna, make sure we teach, mom probably knows, but dads, that you wipe front to back. And a little bit of blood in newborn girls are okay. It's just like that hormone imbalance. We're also gonna check out the anus, and we are going to take one finger just to make sure that it's good, check the folds. And then we're also gonna take the baby, and we're just gonna make sure that the spine is good. We're gonna check for hip clicks, so we're gonna rotate hips, just like this. And we're gonna lift the knees to the chest, make sure the baby is flexible, and there's no apparent pain when doing all this. Make sure there's no noises. And for babies, it also is normal for little milk to come out of babies, for their breasts to feel kind of swollen, and for there to be a little bit of milk in there. You're not supposed to squeeze it or anything, but that is normal, that most parents and moms need to be educated over. So right now, then I would just assess the Ballard score and document my findings and let mom know that I'm done with how to do. Thank you.